Good morning. I am Dr. Sandeep Janardhan Tandil, General and Laparoscopic Surgeon. Today's topic we are discussing about an abscess. As we are discussing about various swellings, so this is another common swelling which can happen to anyone, any part of our body. So what is abscess? First of all, abscess is a collection of a pus in any area. It's like a pocket which is filled up with a pus, which can happen from head to till toe in any part. It can happen on any part of the skin. It can happen in your oral cavity, inside your mouth, inside neck, inside internal organs also, like inside chest or inside the abdomen. So any part where there is a collection of a pus, it is called as an abscess. So why abscesses are formed? What are the causes? How patient presents? What are the signs and symptoms of it? How doctors diagnose? What are the investigations? How to treat it, and what are the post-operative care, like after the abscess is removed, what are the care, how to take care, how to avoid the abscess, that we are going to discuss in today's video. So first thing is why it is called an abscess. It is called an abscess. It's a Latin word which is meaning go away. That's how the word abscess came into the picture. We discussed abscess is a collection of a pus. Now before going in further details, I would like to discuss how the abscess is formed, why abscess is formed. Like we'll simultaneously discuss this condition with a general topic. Like suppose a thief is entering in somebody's house. So what we do? We call police. Police will come. They will try to capture it, arrest it, and take that thief away. Similarly, whenever a bacteria or virus or anything enters in our body immune system comes into action. So what happens? The body sends an automatic signals to our immune system. Like a police, we have a white blood cells. In white blood cells there are different categories, but these cells will immediately come to that area. They will come to that area, they will try to fight with the bacteria, they will eat that bacteria, they will engulf it, and they will be responsible for swelling and inflammation, and that will form an abscess. So abscess will be having this living and a dead white blood cells which will be having the bacteria, germs in that, and dead and necrotic material inside an abscess. So that's how our body fights against bacteria. So why abscess are formed? So the bacterial infection, fungi and virus rarely cause the abscess but can form the abscess. So these are the causes for the abscess formation. Where abscess can form? Abscess can form on any part, from your head to your face, inside your mouth, neck, as we discussed in previously, any part of the body. So we will just discuss what are the common abscess which happens on our body from the head to toe. We will just go in fast. It can happen on your scalp, which is called as a scalp abscess. It can happen on your face. It can happen inside your nose, in the ears. It can happen inside your oral cavity, tooth abscess, tonsil abscess, in the neck, lymph node abscess can happen, breast abscess mostly in the females who are lactating, armpit abscess happens, which is called as a hidradenitis suppurativa. It can happen inside your chest, inside the abdomen, intra-abdominal abscess. It can happen in your spinal abscess, which is called. It can happen near your groin, the private parts. It can happen on the legs. So different areas will be having different type of the abscesses. So what are the symptoms with which patient will present when patient develops an abscess? Patient will be having pain, which is very important. If there is no pain, patient may not go to the doctor. So pain is very important. Patient might have fever, swelling in that area. The skin will become red. Depending upon which part the pus has formed, abscess has formed, that area will be having symptoms. Like if it is in ear, will be having ear pain, earache will be there. Inside the nose, it will be painful. Inside nose, inside oral cavity, the gums, toothache, teeth will be hurting, tonsils, your throat will be hurting. Whichever area it is happening, that area, the symptoms will be somewhat different, little bit different will be there. If it is inside abdomen cavity, you will be having a pain abdomen. As the pus inside the chest or inside abdomen cannot be seen, usually the patient will be presenting with the pain, fever, and discomfort will be there. What investigations you can expect? when you develop an abscess. If the abscess is easily visible, like if it is on the face or the body, you also can diagnose yourself having abscess or the pus in that area. Doctor will also just find out the cause for the abscess, like if it is ear or nose, oral cavity, he will try to find out the pus is coming from which part, and accordingly he might ask the investigations if required. If it is inside the chest or inside abdomen, you might require ultrasonography, CT scan or MRI to find out the size, exact location, from which organ it is coming. Investigations will help in guiding us to finding the abscess. Now we will discuss what are the treatment options available for this. A small abscess you can treat at home. You can apply some warm compress on that. Do not try to squeeze or rupture the abscess with pins. Some people will squeeze with their fingernails. What happens is you may not completely remove the pus. You may spread the infection further. So what simple treatment you can try is applying the warm compress on that. You can meet the doctor. Doctor might initially prescribe you antibiotics. Antibiotics sometimes works and they might decrease if it is small abscess, antibiotic might help in decreasing in size. If it is bigger in size, even with antibiotics, if it is not subsiding, doctor will like to take out that pus, because pus will be it will increase in size if you just keep the pus over there. So what you can expect is that doctor will put a small nick on that area and drain it. He will be giving local anesthesia in that area. If it is a small, doctor will be giving local anesthesia. It's a daycare procedure. So once you go to the doctor OPD, doctor will explain you the procedure, give a local anesthesia in that area, you drain it, do the dressing, and you can go immediately home. Next thing, if it is a big abscess, if it is intra-abdominal or inside the chest cavity or related to any organ, doctor will ask you for investigation to confirm it. And if it is deep-seated abscess, he might ask you to do a guided aspiration, like ultrasound guided or CT scan guided aspiration, and that will be sent for the investigation, like testing it under microscope, what type of the bacteria is in that pus. Accordingly, doctor will start treating. Sometimes doctor might put a small tube inside that area, where if it is intra-abdominal or inside the chest, doctor might put a tube so that it continuously drain and remove the pus from that area, so that once the pus drains, the patient fever will subside, pain will subside, and as per the microscopic report of the bacteria of the pus, whatever the bacteria is there, doctor will treat with antibiotics accordingly. Sometimes if it is a deep-seated abscess, which even after aspiration means when if it is deeper and doctor has put a needle to aspirate it, if it's not coming out completely, doctor might need to do the removal of abscess under general anesthesia. So general anesthesia means you will need an admission, anesthesia checkup will be required. Mostly it might be daycare procedure if it is not a big abscess. So doctor will admit you, the procedure will be done, and it might be discharged same day. If it is a deep-seated abscess, means the amount of abscess is more, doctor might admit you to give some IV antibiotics for a few days, and then as per the WBC counts, your blood investigations and your symptoms, doctor will decide when to discharge you from the hospital. Next thing we will discuss is how to take care of the abscess area after it has been drained by a doctor. Like once the pus is removed, how to do the dressings at home. If you are comfortable to do the dressing at home, it's easy dressing, like every day. You should check your wound, whether there is any remaining pus in that. You should gently press it, remove the pus. First, I will say, make sure that your hands are clean. Use the soap or use the sanitizer, clean your hand thoroughly, then only you should touch that area. Okay, or else you will put another infection, another bacteria in that area. As we are touching different parts means when we touch the different objects routinely, we don't clean our hands regularly. So if you're just touching that hands on the already infected area, you may put more bacteria in that area, different bacteria, and then it will take more time for that wound to heal. So how to do dressing is, first you clean your hands, gently open your dressing. After opening dressing, if you have cleaning materials with you, like povidone iodine, which is used for the cleaning, After, you can put some saline to clean that, and sometimes doctor might ask you to use hydrogen peroxide. Hydrogen peroxide is used initially when there is a pus in that area, so that it removes the pus. There are different concentrations of it is available. You should take a proper correct concentration, which is only used for the medicinal purpose. Use that one initially according to your doctor's advice. You should ask doctor whether you should use it or not, then only you should use that. Or else you can use saline, you can use povidone iodine, clean that area. Then if doctor has advised you to put some cream or antiseptic cream in that, you can put it gently, and then apply sterile dressing, which will be available in market or any pharmacy. So apply over that and cover the wound. Every day you should check the wound, do the dressings. And if you have any doubt, like if you are still having persistent fever, you are having pain or pain is increasing even after doing dressing, you should go and meet your doctor. He might want to check it again whether there is a further deeper abscess, if there is a significant amount of abscess remaining inside, which doctor will take care of it. I would like to tell you the different type of antiseptic solutions which are available. So it's povidone iodine, chlorhexidine, isopropyl alcohol, hydrogen peroxide, benzalkonium chloride, hexachlorophene. So these are the different types which are available, and you should discuss with the doctor which will be suited for your skin, and as per the doctor advice you should use that antiseptic solution to clean the area and apply the cream. Different types of antiseptic creams are available, which might be containing the fusidic acid, povidone iodine. So I would like to say, if you develop an abscess on any part, so do not ignore it. If it is small abscess, it might resolve by itself. If it is not getting resolved in like a few days or a week, try to seek help from a healthcare provider. Initially you can apply some warm compresses. It might help clean that area. Small abscesses might disappear. Doctors might take the medicines, antibiotics as per doctor prescription. Do not try to take antibiotics, or it might create resistance on you, as taking same antibiotic again and again will cause next time that antibiotic may not be effective on you. So it's better you take a consultation from a doctor. As per his knowledge, he will advise what is a better medicine for you. Then if the abscess is not going by itself, it's better you drain it properly, completely. If it is incompletely drained, then it might keep on spreading inside. Okay, and after the abscess is properly drained, make sure it is dressing is done regularly till the wound heals. Usually after the pus is drained, wound heals within 2 weeks, unless patient is having some other comorbidities, like suppose having uncontrolled diabetes. It might take time to heal the wound. But in a healthy person, if an abscess because of bacteria happens, usually it heals within 2 weeks. Next thing I would like to tell you is how to prevent this abscess. Prevention is always better. So I will advise you avoid quitting of smoking, avoid sharing your towels, your razors, frequently hand washing. Hand hygiene is very important. So frequently cleaning your hands or using the sanitizers, practicing good dental hygiene, and having a healthy diet. All these things will help you in preventing abscesses. So hope you understood what is abscess, how it forms. Thank you for watching me. Thank you very much.